We're going to now get into some of the practicalities of putting this philosophy into your work. But before we begin that, we maybe should say that, if you get tired sitting in these seats, I don't know how comfortable they are, then feel free to stand up, lie on the floor. We were saying to Josephine, we were in New Zealand doing a workshop some years back, and a lot of our Maori colleagues came right in with a cushion and lay down right at our feet. It was wonderful. So please be comfortable. We want to give you an overview. We developed a theory of the person that is represented here. This represents the three domains of the person. A domain is where you live. And we believe that we have three domains, three places in which we live. The self-domain is your private place. That is a place where you live with and keep all of your thoughts, your feelings, your beliefs, your ideas, your imagination, your vision, all of the things which you might call intangibles, but which you know what they are, right? And you keep them there, and no one else knows what they are, right? This is your private world. That's where you keep your past, and that's where you keep your imagined future. Everyone has a self-domain. As soon as you tell someone else something about something from the self-domain, you immediately move to the world domain. That's where you bring something from your private world out into the world, right? And share it with someone else. You might say, I had a dream last night. You take the dream from yourself and you put it out into the world. You only put out into the world what you are willing and what you choose to put out into the world. What's important about the self-domain is what we call madness or mental illness or psychiatric disorder or emotional disturbance all begins in the self-domain. This is where it rises up, and some people keep it hidden there for all the time, and no one else is aware of it. But many people either tell other people about this or express it in some coded way so that other people say, there's something wrong with her. What is it? Right. The other's domain is where we are right now. We're all in the other's domain. It's where you live out your life with other people. You share, as somebody said, some of yourself with other people. You do things with other people. Not always constructively, because in the other's domain we also, when people are having a war, they're in the other's domain. But it's where they act out stuff which is from the self-domain, which they may only have shared with other people in small pieces in the world domain. All of the elements of the Tidal model are related to these three domains. We think it's very simple. We have a holistic assessment that I'm going to walk you through in a moment. A holistic assessment is about finding out who is this person, who is called the patient. The one-to-one sessions are about addressing what is important to the person right here and now, today. The personal security plan, well, it is hopefully it does what it says on the name. It's about what kind of conditions would be necessary in order for the person to feel personally secure within themselves. And then lastly, we have three forms of group work, which belong to the other's domain, where people can engage in some kind of activity where they may express something of themselves that may be meaningful and important step for them, and they may also be affected by other people doing similar. But we will let you find out for yourself what these things represent. We're not going to bother about that. You can read about it in Jerome's translated manual. Let's begin with the holistic assessment. This is only done once at the beginning of the relationship. It serves as a rehearsal for all the conversations that follow. Now, we didn't say that. Some of the people that we worked with, when they had experience of it, said it's like a rehearsal because the way that you talk with us, the way the questions are phrased and so on, they're like the same things that occur in the one-to-one or sometimes come up in the security plan or in the group work. So it's a rehearsal. It helps people to get in the mood, if you like. It locates the person's story as the most vital story. Now, by vital, we mean alive. And because it's alive, it is obviously really, really important. But we're not pretending that in the context that you work, that makes this all-powerful. The most important stories, if you are a psychiatric patient, here or anywhere else in the world, is not this story. It's a story that the psychiatrist writes, or the social worker writes, or the psychologist writes, or the nurses write. They're the ones which determine really, will you be discharged or will you be kept here, right? That's the administrative story, if you like. But as far as what is real, this is what is real, the person's story. And it illustrates all the 10 Tidal commitments. Now, we're going to show you, after we've walked through it, what the paperwork is like, because we did develop formats, templates for this. And as we said, our consumer consultants helped us revise, keep changing, adapting, improving, enhancing. And these pieces of paper are widely used by lots of people. But you don't have to use that. If you have a better way of doing the same thing, by all means, do that. Because it's, as Poppy said at the beginning, this is a mindset. It's a way of thinking. It's not a rigid technology. So it begins by inviting someone to tell the story, and it's you're emotionally shipwrecked on the beach. The question that any sensible person would ask is, well, so what happened? How did you come to be here? Tell me about it, right? In your own words, right? Now, one of the expressions that we have grown to dislike from our professional experience is an expression called listening skills. A lot of professions get taught listening skills. They get taught how to sit and how to position the chairs and how to kind of put your hand like this, and to go and, to pretend that you're listening, basically, right? Now, as far as we are concerned, there are no rules. You want to throw all these rules out of the window, and you want to do what is comfortable for you, but especially what is comfortable for the person. Important to do what fits the context. But it's especially important not to pretend to be listening, right? But to give people a good hearing, right? So when you say passion, I say passion. Tell me more about that, right? And you'll say, well, passion is, right? And I will learn the words, and you will use a word that I don't quite understand, and I say, when you say, and I use the word, that means, and you say, that means, right? And you will, now, so you see here how this is interactive, and it's also developmental for you, because you know what passion is, but when you try to teach a fool like me, who doesn't understand what you're saying, you will come up with examples, alternative words. You'll tell stories that maybe you haven't ever thought of before, right? You will change. And this will help you take back ownership of the story of your distress, difficulty, whatever you want to call it, right? If you want to call it bipolar disorder, that's fine. So tell me about this bipolar disorder, right? We developed a template like this. It's not important for you to read the text here, but what's important about it is, as Poppy said at the beginning, we sit down with the person and we give them an explanation or rationale. You know, this is the first time we met. I don't really know much about you. I know you came in the other day. Blah 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 blah. Right? I'd like to find out more about you. You know, I use this kind of format here. It's just a bunch of questions basically, where I might find a little more about who you are, and maybe in so doing you'll find out a little bit about me. But I'm not that important. It's you who's important. I'll give you a copy of this. So you give the person a copy. They sit this on their lap, and you say, see, it's we'll use these questions just to get a conversation going. Now, as we talk, do you want to write the answers? You know, for yourself, and how many? 25% of people take the pen, because I don't really trust you, right? 75% of people say, that's your job, you do it, right? We met a lot of people who say, well, but you see, a lot of our patients are illiterate, so I'll write it for them. Well, why would you do that? You can offer them the pen, and they don't have to say, well, I can't read or write. They can say, you do it, so they can maintain their dignity. It's simple. So the person will either write the answers, or you will write the answers on their behalf. But you will always say, what do you want me to write here in this first box? And the reason why we have these boxes is because you and I have a conversation. We talk for 10, 15 minutes, and we say a lot of words. And at the end of it, I say, we've been talking for 15 minutes. What have we talked about? And you say, well, we talked about this, and I told you about that, and then I also told you about the other. And it all shrinks down to just a few lines, because most of it is just padding and repetition, right? So we listen and say, what do you want to write down? And people will say, I want you to write this down, I want you to write that down, but I don't want you to say that, because I only told you that. That's good, right? We begin with, how did this all begin? How did you come to be here, right? You always begin every story at the beginning, and people will say, well, this all started when I was 10 years of age, or this all started when my marriage broke up, or this all started at the full moon, right? It could be last week, it could be 20 years ago. The story that they're going to tell you begins at the beginning, and you invite them to tell you how it began, and you ask supplementary questions, whatever seems appropriate, as you express interest, curiosity, as Poppy said, and then you say, well, what do you want to say about how it all began, right? Then you will say, right, and you will say, so what you're telling me, Jerome, is that this all started blah, 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 blah. So how did that affect you in the beginning? How did it, what effect did it have on you and the kind of living of your everyday life? And he will think about it, and he maybe raise his eyes to the ceiling, and because he either hasn't thought about this, or he hasn't thought about it for some time. And he will say, well, it affected me in this way, and that way, and the next way, right? What do you want me to write down here? You write down what the person wants, or they write it down for themselves. So, and then you repeat, you summarize what they said. So this all started then, it affected you in this way. How did you feel about this in the beginning? Back there when you were 10 years of age, or when your marriage broke up, or when you saw this full moon. How did you feel at that point? And again, people will look up into the corner and they'll try and remember, how did I feel? And they will reclaim, pull back that memory of how they felt, and they will tell you. And you will ask supplementary questions, and when you think you've got enough, you will write that down. And then you'll say, well, that was then, 20 years ago, or it was last week. How's it changed since then? What's different? Because something is different, right? Because we know that time is flowing through us. So what has changed? And they'll say, well, and they'll have to think about it, right? And they'll have to explain it to us, and we will ask damn fool silly questions, right? And he'll have to explain to us. And the more he explains to us, the more he understands. Now, it's important to say at this point, this whole thing is not for me, the nurse, the therapist, the doctor, the whatever, right? It's not for me, it's for the person. Yeah, I will learn a lot about the person, but the really important student here is the person who is telling the story. Then lastly, we'll say, so, I don't know who's in you, I don't know what your family's like or what friends you have or who you work with, but this story you're telling me, da 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 da, what effect has this had on the people around you? Now, a lot of people say, well, I've never told anybody this, or nobody knows that I'm here. So what's that like? And people talk about how difficult it is to keep a secret when you're in a relationship. Or people will talk about, well, how people have left them or fallen out with them or are over, are smothering them with whatever. What effect has this had on the relationships? Now, these are really obvious questions. Get to the end of this page and we say to the person, how do you feel about going on to the next page? Right? Some people say to us, oh, gee, I'm exhausted. I need a smoke. I need to go and lie down. If they do, we say, that's fine. Let's take a break here. You make an arrangement. Right, it's 20 past now. We can come back in what? Maybe half an hour. Does that suit you? Or come back tomorrow. Some people spread this over several days. Some people do it all as one thing. There are no rules.